Hello, I am Dr. Mirela Cerneanu, and I welcome you to the Wellness Optimizing Warrior MD podcast, the WOW MD podcast. I am not your typical wellness coach, and this is not a typical wellness podcast. Here, I'll discuss educational facts about health, hormones, intimacy, anti-aging, and beauty trends, all very hot topics, to empower you to make great choices when it comes to your health and to your body. I want you to go, wow, I did not know that. Or, wow, this is going to make a great difference for me. Our healthcare system is broken and it needs a revolution. You and I can start one today. I am willing to share my knowledge with the world if you're willing to listen. Let's get started. Hello, listener, and thank you for joining me again on an episode that is going to talk more about the complicated, difficult to understand U.S. healthcare system. In the previous episode, I introduced you to some basic facts you might have not known. Specifically, I provided some tips about deductibles and used some examples to illustrate what a deductible means. I presented some information about coinsurance, maximum out-of-pocket costs. I talked about choosing a doctor who's in network versus PPO, what is the difference, etc. What I'd like to talk about in this episode is a little bit more about the healthcare system and why is it so broken. And I'm going to start by pretty much addressing the key issues that I think personally are affecting our healthcare system. And let's start with the Affordable Health Care Act, or the ACA, or Obamacare. The Affordable Health Care Act has changed the system in ways that were advertised and taunted as being simple, highly beneficial to us, the consumers. But in reality, it fueled a huge rise in premium costs to cover stuff that is affordable to some, specifically the underserved, but at the same time, making healthcare insurance unaffordable for many more people who are actually paying for their own plans outside of employer-sponsored plans. The introduction of the Healthcare Act was supposed to help lower the number of uninsured Americans. Again, that was its goal and its purpose, lower the number of uninsured Americans. I'm going to provide you with some statistics and some very interesting numbers. In 2013, there were 33 million uninsured Americans. In 2023, only 10 years after Obamacare was launched, there are 30 million uninsured Americans. So thanks to Obamacare, or the Affordable Care Act, 3 million more Americans are now insured as opposed to 10 years ago. But think about this for a second. In 2023, more than half of Americans that have some form of insurance feel and believe that healthcare insurance and healthcare costs are unaffordable. The Affordable Care Act revamped and restructured the healthcare industry and introduced what's called the healthcare marketplace in order for 3 more million Americans to get insurance. And in order to do so, it made affordability of actual healthcare insurance and affordability of healthcare costs a huge financial burden for over half of insured Americans. Again, maybe rewind and listen to this for a few more seconds. I posted in the show notes a link to this very interesting survey that presents these facts. So please click on it for more information. So me telling you that healthcare has become unaffordable for many, it's not new information. If it is new information, or if you don't believe me, please read more about it. These are the facts. So then how do we address this? Well, how do we get less cost? How do we cut down the cost? How do we get to a lower cost healthcare system? Well, I'm going to provide you with some very novel and interesting approach, and I'm going to make it very simple. In my mind, it makes sense that in order to have a low-cost healthcare system, we have to trim the fat. This means we have to get rid of some of the unnecessary bureaucracies and organizations that have literally popped up like mushrooms and are nothing other than parasitic developments that bring zero contribution to improving our health care in any way, shape, or form. I'd like to talk to you a little bit about the link that I have placed in the show notes at the bottom. This is called Your New Healthcare System. It's a PDF chart, so please go to it and click on it. If you're driving, please don't do that while you're driving. It's going to be very confusing and upsetting, and I don't want you to go through that. So you have to go back to this episode and this part of the episode when you're not driving. So please click on the link, open the PDF. Again, that's entitled Your New Healthcare System. Look in the right bottom corner for the symbol that says Patients, and then look in the left bottom corner for the symbol that says Physicians. Between you, the patient, and us, the doctors, everything else that you see in there is literally a barrier to healthcare. Fact that we need to trim. We are not going to get to affordable healthcare with a chart like that. And if you wonder how we got here, please know this is an excellent question, but a much more valuable question would be, how do we get out of this? And again, I've already gave you my very simple answer. And unfortunately, you know it already. We have to trim the fat. Now, here's the problem and the conundrum, because neither you, the customer, nor us, the physicians, again, right bottom corner, left bottom corner, have this ability to trim the fat. But all we can do is pretty much say no to whatever's going on right now. And then we can talk about this more in the future. I want to come back to unaffordable healthcare costs. Our healthcare costs have become unaffordable in spite of having healthcare insurance availability. And it's because the healthcare premiums for healthcare insurance have become unaffordable. They're so high and so expensive that a lot of people cannot pay for them, or if they budget and pay for them, it's a huge financial burden. Many have to struggle to pay the health insurance premiums. And what's interesting is because they pay such high premiums, then you, the consumer, obviously, if you pay a lot of money, you should have super high expectations of what you should get for this amount of money. So you think, well, I'm paying $1,000 a month. I should get a lot of services. The reality is you get minimum or much less services than you did as you would have gotten 10 years or 20 years ago, because the insurance plans are charging more and more, and they are paying for less and less medical services. Again, this is reality. And if you are not aware of it, please be aware of it now. Insurance plans are charging you more and more every month. Their costs for their premiums go up every year. If you don't know, just go back and look what your monthly cost was 2 years ago. On the flip side of it, the same insurance plan is paying less and less for any of your healthcare costs. So to fight back, or as an alternative, many people simply choose to go bare without insurance, pay the doctor directly, and they make a priority and a very big goal of not getting sick. So they want to invest in promoting their wellness. This is happening more and more often. Paying the doctor directly for services used to be the way we did it back in the day. Now, I'm not advocating for it. I personally have health insurance through my husband's employer. It's too expensive for me to have it on my own. And please be aware that going without insurance is not something I advocate for here on this podcast. It's a private decision you have to make as a person. And if you are after 50 and have a certain age and certain health issues, you need to get some form of health insurance because surgeries are needed. You break this, you break that. Medical care for ER visits and all kinds of things that happen are needed. And you can actually go bankrupt easily if you need any kind of services in the hospital, or God forbid you get cancer. you should have health insurance for that. And we'll talk more about that and what catastrophic health insurance might mean. But coming back to paying the doctor directly for services is the way it used to be back in the past. And did you know that the first health insurance organization was created in 1929 during the Great Depression? It became a thing and really took off in the 1950s, and Medicare was launched in 1960. What is super interesting is that back in the day, 50, 60 years ago, insurance companies used to pay doctors and hospitals significantly more for visits and procedures. The truth is, their payments to doctors have dwindled so low now that the private practice solo doctor is an absolutely dying breed. I will get more into that later. Let's get back on track with the discussion of people who are actually paying their doctors directly and paying the hospital directly before health insurance and Medicare were in effect. For quite a few years, this trend is happening again and again as the cost of monthly premiums is so insanely high and the coverage benefits you can buy for these insane costs are minimal. So if you understand, you sit down, you do the math, like many others, you would realize that the purchase of health insurance might be impossible and unaffordable unless your employer will sponsor a large part of that premium. So more and more people might decide to go without insurance or buy catastrophic insurance, and that's happening in spite of the Affordable Care Act. On the flip side of it, more and more doctors are tempted to go out of network and simply name a reasonable cost for a visit that they would like to charge, and they prefer to get paid directly at the time of the visit. And by doing that, both the patient and the doctor will seriously and significantly cut out some of the fat, which is the middleman. That would be the insurance company, the biller, maybe the software company, etc. Now, the fact that more and more doctors are choosing to shut down their practices, and the fact that private doctors are a dying breed, makes the private doctors available for an insurance panel very narrow. So you are left with only having availability in your area for doctors that are part of large groups or smaller groups, but these are nonetheless groups that are funded and run by corporations, private equity firms, or by the local hospital's foundation. Yes, you heard right. Hospitals, they actually pay and manage their own group of doctors. Is that a conflict of interest? I will not answer this question. I will let you be the judge of that. However, on a side note, I remember 5 years ago or 6 years ago, one of my colleagues that's an OBGYN practicing at a local hospital here, owned by the Health Corporation of America, HCA, participated in a meeting where the local OBGYNs were told that the hospital's goal was to hire a group of 8 OBGYNs, ideally, who will oversee all the patients in the area and deliver all the pregnant women in the community within range of the hospital. They would only work for the hospital, and they anticipate that there's no need for private doctors like OBGYNs in the community. So is there a downside to seeing a group of doctors versus your own doctor? I'm sure you know the answer to that because you've already seen different doctors for the same condition. You've already heard different opinions about the same condition from different people. You might have seen a PA or nurse practitioner instead of the doctor as you expected, but that is what you get from going to a group. Now, since more and more providers and private practices are either going out of network or going concierge, and then the remaining in-network doctors are employed by these large groups and large clinics, keep in mind that finding a physician educated with up-to-date technologies that is personable and competent and who is willing to accept your insurance is going to get more and more difficult. The majority of available physicians in network with your PPO or Medicare or HMO really belong to major groups and clinics that are owned by private equity, private investors, or by hospital corporations. And that literally means you have to go through the maze of robots and phone prompts to leave a message, wait on hold over 30 minutes to get connected to someone, and more and more and more like this. You've been there. You've personally experienced it. I'd like to take a little detour, and I'm going to use a personal example on how this healthcare availability crisis affected me personally as it pertains to my mom's healthcare. My mom has a state-run plan, and she needs cataract surgery. So I tried to make an appointment with a clinic, and I wanted to go to the best. So I did some research, and I found out that there are some really good doctors at UCLA, and apparently they were actually accepting her plan for a cataract consultation and surgery. Now, my mom is on a time crunch. She spends 5 to 6 months out of the year in the US and 5 to 6 months out of the year in Romania. So she came in, and I needed to get her in as soon as possible. Now, the clinic I chose had only one location available that accepted the plan she had. So in spite of UCLA having a ton of clinics with a lot of ophthalmologists in different locations, only one location accepted the plan she had. So I found that out after calling different people at different locations, at least 3 of them, and spending about 45 minutes on the phone. Finally, someone did tell me that and gave me the phone number for the clinic in LA who was accepting her plan. By the way, it was in a terrible area. So I called trying to get an appointment, and I literally waited 45 minutes on hold without being able to get a hold of a human being. And after that, I gave up, and I decided to call a doctor that was local, had good reviews, made contact with his office. I got a cash price. I booked her consultation. 2 weeks later, she had a cataract for her left eye. Yes, I paid out of pocket thousands of dollars, but we got what she needed done, and in good time, because again, she needs to leave and go back home, and you can't let the cataract untreated for a long time. It will get worse to the point where it cannot be resolved. So if you are listening to this episode and this small personal side note rings a familiar bell with you, then I'm sorry you found yourself in this situation. Not everyone can afford to do what I did, pay thousands of dollars to get the services we needed in the time we needed it done. Most people are not so fortunate and have to wait for months to get to a doctor that is reliable, has experience, and accepts their plan. On a side note, I personally start the conversation when I call any clinic on behalf of my mother by telling them I'm a doctor. It changes the perspective. Yes, it is a power play, and it's one that I'm doing intentionally to establish respect and rapport with the person at the other end of the line, letting them know that I'm expecting prompt and great customer service, which I usually get. So being a doctor serves me well in other areas as well. However, not everyone has a doctor in the family that can make phone calls on your behalf or call the back office to get you in front of the line for an appointment. So this brings me back to the issue and the point I was going to make about how availability of excellent customer service and healthcare in today's day and age has become a huge issue. So that's why if you find a doctor that meets all the requirements I talked about in my previous podcast episodes, who has all the attributes I talked about, and who also accepts your insurance, consider that doctor a gem and hold on to him or her and that practice. The truth is, the times when doctors were everywhere, and if you didn't like your doctor, no problem, there were many more available, those times are gone and not to come back anytime soon. I was reading an online article about the demise of private practice, and the writer made a very valid point that unless the Medicare payments and the insurance plan payments become fair, and as long as doctor payments continue to get cut, there will no longer be a viable option to be a private practice doctor in the U.S. that will accept insurance, as the cost of doing business and overhead has skyrocketed, while the payments to doctors have stayed the same or are actually getting cut. So this kind of answers a little bit the issue of doctor availability, but this is happening worldwide. We do know that in Canada or Australia, New Zealand, etc., where there are universal care systems in place, you have to wait in line to get a procedure. And there are very strict guidelines imposed on who qualifies for that procedure to get in the waiting line and who doesn't. Now, United States has for decades and historically always taken pride in being the best healthcare system in the world, and that included accessibility to the best care in the world. That is no longer true. And let's talk a little bit longer about this availability and access to healthcare, because access to good medical care has become a super hot commodity in the past decade since Obamacare, and it is getting worse. Let's talk about why this is happening. Well, number one, we are facing a physician shortage. I will talk more about this in the next and last episode in the series. However, I will give you some information here. If you didn't know that we are facing a physician shortage, please Google it. Doctor shortage. Very simple. There's a lot of facts and a lot of information. They're all there and available for you online. The supply of healthcare providers, especially doctors, is decreasing in the United States. Again, if you have not heard about this, the facts are all online. Google doctor shortage. There's lots of information that comes up. And some of what I'm going to discuss further might be shining some light as to why doctors are going away for good. So number one, we're facing a physician shortage. So that makes it difficult to get access to care. Number two, we are still going through the Great Resignation post-pandemic. There has been a shortage of getting well-trained, caring, and hardworking ancillary medical support personnel from many practices, from many clinics and hospitals. So it's hard to find support to practice medicine, and it's hard to find good people. Please go back and listen to my episode about the value of a high-functioning medical team, because you'll find some very important information and facts about why we need good quality people, not people who answer the phone, don't want to listen to you, and are ready to pass the bucket to the next person and say, not my job, I don't know anything about it, can't help you, call back later, I'll take a message, we'll get back to you when we can, so on and so forth. You've been there, heard that. Number three, we have a significantly growing aging population, and the demand for healthcare services has increased drastically in the past 2 to 3 decades. So we have physician shortage, we have shortage of getting well-trained, hardworking, pleasant medical support personnel. We have a growing aging population with high demand for medical services. And last but not least, the healthcare insurance market has changed drastically since the launch of the Affordable Care Act. So you're going to say, well, what's that got to do with availability and access to care? Well, the monthly insurance premiums have absolutely skyrocketed, whereas the healthcare insurance plans have not increased physician reimbursement. They continue to pay very little. So if you didn't know how little they pay, let me tell you here. Let's say you come in for a wellness visit and you have other medical issues that you need to address, like hypertension, diabetes, poor sleep, anxiety, depression, thyroid, fatigue, hormonal imbalance, etc. Well, your plan is likely not going to pay to address all your problems and have a wellness visit. It's got to be one or the other. If the doctor is going to take all the time in the world to get everything, listen to you, examine you, update your chart, address all your conditions, then the doctor will get paid only 50% or less, or not at all, for taking care of all your problems instead of just spending 10 to 15 minutes and saying, okay, you need a colonoscopy, you need a mammogram, you need a bone density, here's your blood work, and here's your refills for all the medications. So how do practices deal with this? Well, they do not schedule same day multiple appointments, and they do not address wellness and medical problems in the same visit. So it's not unusual for you to need to see your doctor many times for the same problem, because this is again driven by the way insurance plans are reimbursing physicians. And let me tell you another piece of information which you might have not known. Let's talk money And just so you know, a visit that lasts about 45, 50 minutes will usually get paid maximum $175, just about under $200 by insurance plan. So just think about this for a second. If the doctor will need to spend 45 to 50 minutes with you and spend about 10 minutes to tidy up all the paperwork and be ready to move on to the next customer, think about how many visits do you think will be needed in a day for a practice to survive? Well, there are 2,080 working hours in a year. If you multiply 175 by 2080, you get about $365,000. And that is the net worth of what your plan will pay your doctor and the maximum your doctor can make throughout the year. Well, no practice can survive that. If this is a doctor that's solo in private practice, the cost of overhead, the cost of labor is much higher than this. Now, the doctor will have to offer some sort of cash service or impose a concierge fee just to be able to stay in practice, or simply decide, I'm going to close the practice, sell the practice, retire if possible, and then join a hospital group maybe. Let's come back to this reimbursement for a second. Most plans get their reimbursement rate from Medicare. Medicare sets the standard and keeps the rates low. I'm going to read a very short quote from an article written by a news writer that's published on the American Medical Association website. Falling Medicare payment rates, when adjusted for inflation, are a 26% drop since 2001. That is referring to payment for physician services. So let me repeat that in case you think you did not hear well. Medicare payment rate, when adjusted for inflation, compared to 2001, is almost 30% less for a medical visit. Now, consider the overhead cost, consider the rent, the malpractice, consider the human employee cost, and then ask yourself if this is fair payment for the doctors who would like to own their own practice. And the answer is no, this is not fair. Most doctors who really are experienced and trained in true wellness and trained in anti-aging are not going to want to take these Medicare rates, because if they participate in Medicare, they are obligated to accept the low rate of pay set by Medicare. Now, these doctors have the most knowledge and the most value that's needed for seniors or anyone over 50. But our healthcare system does not value your wellness. You're the only one that needs to value your wellness. Also, keep in mind that Medicare pays for a wellness visit for a woman every 2 years, not even every year. Also, interestingly enough, Medicare does not reimburse for regular preventive codes. Medicare has special codes. And unless you, the doctor, are savvy about these codes, and you are trained and go to coding classes or look it up online, you are going to provide a lot of free medical care. So most doctors smart up in a business sense and choose not to accept Medicare as they don't get paid face value for the time spent with the patient. So let's talk a little bit about the doctor shortage. I promise I will get down to it and give you a little bit more information in the next episode, but I want to touch on this a little bit today. Think about the fact that there is no significant incentive for anyone to become a doctor in today's environment. The cost of a medical education leaves doctors in debt, huge debt, that would take 10 to 20 years of private practice or employed practice to just be able to clear the medical school debt. There is a bigger and bigger push to allow doctors from other countries to come practice in the United States. I am a foreign medical graduate. I came here in 1997. I had to redo my residency program in order to be accepted into the healthcare system of the United States. There is a big push to allow doctors to skip this step and start practicing without being trained by a residency program as a safety valve for serving the healthcare needs of a growing aging population. Now, this is not really a solution. In my opinion, this is really just shifting the workforce around the world, as dedicated and talented doctors will leave their countries to come work here. as doctors in the United States still get paid more than other countries. That will unfortunately leave those countries in a pickle. But that doesn't seem to bother the people who are coming up with these grand ideas on how to address the physician shortage. And I will post another link down in the show notes about this article in USA Today talking about doctor shortages. And it's been just published in June of 2023, so I think it's interesting. If you're interested, please read it. So there's a lot of talk about why we don't have enough doctors. Again, all you have to do is Google doctor shortages. Lots of information and articles will come up. USA Today, NPR, American Medical Association, Wikipedia. Everyone is talking about the doctor shortage. And I have my own opinion, which I'll be happy to share with you, as I come from a country where medical education is free. If you expect doctors to spend hundreds of thousands of dollars to get a medical education, and you limit the school availability, and then you want to pay them $250,000 a year before taxes, which comes up to $150,000 after taxes. And if you think that makes them rich and they should be happy to practice medicine for this amount of money, then think again. The truth is, we, the doctors, do not think about money very much when we make decisions about our careers or about the type of practice we're going to choose. Some of us are not good business decision makers. We know nothing about business, and we are far from being the heartless, ruthless executive decision makers we might need to be in order to be super successful in business in today's climate. We make decisions with our heart and with our emotions all the time. Another issue that's a big problem is that the lack of respect and understanding that rolls down from the executive levels and surrounds us everywhere in our daily lives, sometimes from patients, sometimes from our support staff like nurses or assistants, or from other doctors, will eventually get to us. So there's a lot of talk about doctor burnout. And yes, we doctors are overworked. But believe me, we are workhorses. We love the work. We wouldn't mind the work, and we wouldn't be bitching about the pay if we would receive the respect and understanding that we deserve. Everyone in the healthcare industry believes on some level that doctors are simply people who are replaceable. The truth of the matter, and not because I like to toot my own horn, but because this is the truth, doctors are extremely talented, dedicated, hardworking, passionate, idealistic, and caring people. The current system and the way it's organized is putting so many barriers and so many restrictions in allowing us, the doctors, to do what we love to do, which is simply take care of you, the patient, make you healthy and happy. So many doctors give up. They sell out. They fall in line. They become employed, and they do as they are told by ruthless, heartless, disrespectful executives. And that is the problem. Now, I told you I'm going to give you my opinion, and you might not like it. So I will come back to this issue a little bit more in the next and last episode in this series. But for now, I will end here. And I will let you ponder some of the things that I discussed in this podcast. Obviously, there's so much more to say. I could probably talk for hours, but it's best to end here. And I will come back next week with final thoughts and facts on our complicated healthcare system. Again, thank you for listening, and we'll meet again next week. If you liked the information you heard and you'd like to hear more, please subscribe and follow my podcast. Should you find the content helpful to not just you, but possibly others, please share it and feel free to leave us a review. You are welcome to join the Facebook group, The Warrior Optimizing Wellness MD. I certainly hope that you've heard many things in this podcast that made you go, wow, I did not know that, or wow, I'd like to know more. So keep listening and I'll keep talking.